to go.
Hi, so what is your name and your job title here at Mayo Clinic?
Well, my name is Dexter. I'm a neurologist, and I'm a fellow of the American Academy of Neurology.
And I'm just going to ask you questions about brain imaging techniques. How frequently do you use scans when caring for patients?
Well, it varies a little bit. In the hospital, particularly in the emergency room, it's very common that we use scans. If someone's coming to the emergency room for a neurologic problem, we almost always need a scan of some sort. In the clinic, it's not uncommon, but it's not nearly as frequently as it is in the hospital.
And what brain imaging technique do you use the most?
We probably still use mostly CT scans, which is a computerized X-ray, because it's fast and it's easy to get and it's less expensive. MRI scans, which uses a magnetic energy field to generate images, is certainly gaining in popularity now. They're just a little bit harder to get because they're longer and more expensive.
What is the greatest benefit from using any of the scans?
Well, the greatest benefit is when you get a diagnosis. We had a case last week when I was on call, a patient who came in who was unconscious and wasn't waking up, did a scan, and we found that there was abnormal fluid in the ventricles. We weren't sure if it was blood or if it was bacteria, pus, so we had to do another test, a spinal tap, to get the diagnosis, but we wouldn't have got the diagnosis without the scan. So the major benefit from scans is sometimes it gives you the final answer to the reason why the patient's here.
And are there any disadvantages to using any of the scans?
Well, CAT scan does expose patients to radiation. The amount of radiation is relatively small, but there is some radiation exposure. So repeated scans, particularly in young people, we try to avoid. The MRI scan can't be done in people that have metal in their body or a pacemaker and that sort of thing because the magnet is so powerful. The other disadvantage is the cost.
And are there any new advancements lately involving brain imaging coming to the field?
There certainly are. There's now imaging studies that allow us to visualize markers for certain diseases such as Alzheimer's disease. We can use markers that identify beta amyloid, which is a marker for a marker for Alzheimer's disease. We can identify a marker called tau protein, which is a marker for frontotemporal dementia. And there are now scans that can identify dopamine transport systems that help us make a diagnosis of Parkinson's disease. PET scans, which we do some here, also help us with differentiating Alzheimer's disease from frontotemporal dementia. And those are relatively new scans.
And my final question is for you. What do you find most rewarding about being a neurologist and using advanced technology like various brain imaging techniques?
Well, the most rewarding thing is helping patients. I think even when we can't cure diseases, we can almost always help, and that's what I like the most about being in medicine and certainly in neurology. The ability to solve the puzzle and get an answer, that's intellectually stimulating and rewarding, and that's what scans really help us with a lot of the time.
Thank you so much for your time.
You're very welcome.
Mm-hmm.